Okay, let's dive into this. Welcome to this explainer. We are doing a rapid-fire clinical review today covering high-yield surgery MCQs on sutures and electrosurgical principles. We're getting straight to the point, so let's get to work.
Clinical Review, Part 1.
The most appropriate suture for closing a midline abdominal wound is A. Silk, B. Polygalactolic acid, C. Polypropylene, D. Polydioxanone, E. Polyglycolic acid. You're looking for C. Polypropylene. Why? Because you need permanent tensile strength for complex or reoperative cases, and polypropylene delivers exactly that.
Let's hit some exam pearls. For standard abdominal closure, PDS is your go-to. But for a complex or reoperative abdomen, use polypropylene or nylon. For suture technique, remember that taking 0.5 centimeter small bites actively decreases the incidence of incisional hernias.
Which of the following absorbable monofilament materials is used to repair the rectus sheath? A. Polydioxanone, B. Polyglycolic acid, C. Polypropylene, D. Polygalactin, E. Silk. The right choice is A. Polydioxanone. The rectus sheath is a slow-healing fascial structure. It literally requires prolonged mechanical support to heal, and polydioxanone, or PDS, does just that.
Exam pearls. Mass closure means incorporating all musculoepineurotic layers together. Simple continuous suturing has the huge advantage of distributing tension evenly right along the wound line.
Which of the following is most resistant to infection? A. Silk, B. Polypropylene, C. Vicryl, D. Catgut, E. Surgical steel or metal stapler. Option E takes it here, surgical steel or metal stapler. Why? It evokes minimal inflammatory reaction and there are completely zero interstitial gaps for bacteria to hide in.
More exam pearls. On the tissue reaction scale, surgical steel has the absolute lowest minimal reaction, followed by polypropylene, while silk causes a severe reaction. Regarding infection propensity, braided materials physically harbor bacteria inside their strands, so monofilaments are always preferred in contaminated tissues.
Which of the following is the strongest suture material in vivo? A. Catgut, B. Polygalactin, C. Polypropylene, D. Polydioxanone, E. Silk. C is the winner, polypropylene. Synthetic, non-absorbable sutures maintain their tensile strength for greater than 1 year because they simply do not undergo enzymatic degradation.
And this brilliantly illustrates the structural difference. Synthetic, non-absorbable materials retain their tensile strength indefinitely. Biological non-absorbable materials, on the other hand, actively fragment and degrade over months. Which of the following holds true regarding vascular repair? A. 2-0 suture is best for repairing femoral artery. B. At least 3 to 4 throws of well-laid reef knot are required. C. Monofilament sutures is used for repair or anastomosis. D. Vessels should always be sewn with the needle moving from outside to inside along the downstream edge. E. The suture line must be irregular. The answer is C. Monofilament suture is used. Vascular repair demands a smooth, thrombose-resistant, and low-friction material.
Exam pearls for vascular repair. The needle pass direction must always be inside to outside on the downstream edge. Knot security requires 6 to 8 throws, and prosthetic grafts absolutely require permanent, non-absorbable sutures since they never biologically integrate.
Clinical Review Part 2. Which of the following is the latest and most preferable technique for intestinal anastomosis? A. End-to-end anastomosis. B. Single-layer extramucosal technique. C. Two-layer technique. D. Seromuscular technique. E. Through-and-through anastomosis. The preferred method is B. Single-layer extramucosal technique. It perfectly opposes the submucosa while completely avoiding mucosal eversion. Exam pearls on these techniques. The single-layer seromuscular technique by Lambert inverts tissue. The single-layer extramucosal technique by Halstead and Matheson is the preferred choice, and the double-layer technique carries a much higher risk of tissue ischemia.
Which of the following is true regarding characteristics of polygalactin 910 or Vicryl suture? A. It is braided in multifilament suture. B. It gets absorbed in 2 weeks. C. It causes high tissue reaction. D. It is commonly used for skin closure. E. Knotting quality is poor. Option A is the true statement. It is a braided and multifilament suture. This specific construction features excellent handling and causes only a mild tissue reaction.
Recurrent exam pearls. For strength or tension, 60% remains at 2 weeks.
Its absorption profile is 60 to 90 days, and for clinical limitations, you definitely want to avoid using it in skin closure.
Which of the following nerves is most commonly damaged during general anesthesia? A. Ulnar nerve, B. Sciatic nerve, C. Median nerve, D. Tibial nerve, E. Brachial plexus. The answer here is A. The ulnar nerve. Because of its superficial positioning directly behind the medial epicondyle, improper padding easily leads to compression ischemia.
Nerve injury exam pearls. The ulnar nerve gets compressed at the elbow, the radial nerve at the lateral humerus. The brachial plexus is injured when the arm is abducted greater than 90 degrees, and the common peroneal nerve is compressed at the fibular head during lithotomy positioning.
Which of the following is correct regarding diathermy? A. Continuous pulse causes coagulation. B. Alternating pulse causes cutting. C. Frequency of 400 kHz to 10 MHz is used. D. Direct current is used. E. Maximum current flow occurs at point of least surface area. The correct option is C. Frequency of 400 kHz to 10 MHz is used. Why? Because this massive frequency avoids neuromuscular depolarization and electrocution.
Diathermia exam pearls. The cutting mode uses a continuous waveform, lower voltage, and results in cell vaporization. The coagulation mode uses an intermittent waveform, higher voltage, and results in protein denaturation.
Which of the following is the most common injury with diathermy use? A. Channeling, B. Electrocution, C. Explosion, D. Burn, E. Interference with pacemaker. The answer is D. Burn. These are accidental tissue burns resulting from insulation failures, stray currents, or improper pad attachment.
Exam pearls. Comparing the two. Monopolar electrosurgery carries a high risk because the current has to travel all the way across the body. Bipolar diathermy drastically limits that current path, strictly between the forceps tips. Could a partially detached return pad be the most dangerous variable in your next operation? It absolutely could be. When a pad partially detaches, it reduces contact surface area, which rapidly elevates local electrical resistance and creates intense heat. Keep that in mind next time you're in the OR.